Hello, my fellow biohackers. My name is Kayla Osterhoff, and today I will be talking about COVID-19 epidemiology and outlooks. But first, a little bit about me and my qualifications to speak on this topic. I am a health scientist and epidemiologist. I formerly worked for the Centers for Disease Control and Prevention for many years in global infectious disease. And while I was there, I served multiple deployments for infectious disease outbreak responses, including the 2015 and 2018 Ebola outbreak responses in Africa and the 2016 Zika outbreak in North America. I helped to develop the Washoe County Health Department pandemic flu plans a few years ago, which are now being deployed for the COVID-19 response. And that is in Reno, Nevada. I have a bachelor's of science in health ecology and a master's of science in public health. And I'm currently earning my doctoral degree in integrative mind-body medicine with a focus on biochemistry and neuropsychophysiology. Let's briefly talk about what COVID-19 is. It is a novel coronavirus, which means that it is new in the human population, or we have not seen this coronavirus in the human population previously. However, we have seen other coronaviruses, including SARS and MERS. It's a respiratory illness that is spread from person to person through infected mucus droplets and from touching contaminated surfaces and then touching yourself on your eyes, nose, mouth. The most common symptoms include fever, cough, and shortness of breath. And more recently, we have found that in severe cases, it can cause lung, kidney, and heart failure. Now, let's talk a little epidemiology. You may have heard the term flattening the curve, and what they're referring to here is the epidemiology curve, or the epicurve. But what does the COVID-19 epicurve actually look like? Well, the short answer is that we do not have the data to know. But the long answer is that it's probably not as bad as you think. And the reason being that we just don't have good or accurate data. Now, why this is a good thing is because the total number of cases that is being reported is much lower than the reality of total number of cases. However, the number of severe cases and the number of deaths should be pretty accurate because these are the cases that are actually seeking medical attention and being reported. Now, the reason why this is a good thing is two things. One is that the number of cases is likely much, much higher in reality, meaning that more of the population has been exposed and probably contracted COVID-19 without knowing it or having very light symptoms and have recovered. This also means that the total number or percentage rates of severe cases and deaths is probably a lot lower than what the projections that you may have seen on the internet are showing, which are modeled off of the data that we currently have, which, as I mentioned, is very poor. The reason why the data is very poor is because we are not doing full coverage of testing. I'll get into this a little bit more in the next slide, but if you look at this example of an epicurve, you'll see different scenarios here, but in general, the number of cases is on the y-axis and the time period is on the x-axis. And as you move along the time axis, you will generally see in any epicurve that the total number of cases will rise to a peak, and then as time continues to move on, it will go down the other side of the curve and eventually flatten out. And what we are trying to do is get to the flattening before any of these scenarios come true, whereas we see a lot more death, a lot more severe cases, or running out of medical supplies. Now, let's do a quick round of Mythbusters. These are common misconceptions that are going around the internet. And so I thought I would quickly run through a list of the most common ones that are coming across my desk. First off, face masks will protect you from COVID-19. This one is actually true to an extent, though they will not fully protect you, but they are any barrier is a protectant, and they are a good reminder not to touch your face when you're in public. The next one is cold temperatures will kill the virus. The answer to this is no, because the virus actually lives longer in the cold, and actually freezing the virus is the first step in the PCR test. The next one is you might have had COVID-19 months ago, and this is very, very unlikely if we're talking around the holidays or December, because the first cases were reported out of China back in early November, and it did not spread widely until long after that, and globally even longer after that, around February. Is COVID-19 a bioweapon? This one is a little silly, and the answer is no. It has been confirmed that bats in China were the reservoir, and this is where COVID-19 originated. COVID-19 is airborne. The answer is no, but it can propel through the air about 6 feet in infected droplets from a person who either sneezes or coughs. But it cannot just be breathed into the air and travel around and then breathed in from another person and infect them. The last one is, can you get COVID-19 more than once? And the answer is no, this is highly unlikely. And this myth came out of some reports of a few people in China getting COVID-19 twice. But on further investigation, we found that these people actually had false positive tests. So this was actually just a problem with the testing. Now let's talk about how we can flatten the curve. So as I mentioned before, a major issue is a lack of testing. So the first thing that we need to do is mass testing and coverage of the entire population, or as much of the population as possible, with both PCR and serology tests. PCR tests check for current infection, which is what we currently are doing in the US, and serology tests check for immunity and previous infection. Both of these are important, but the serology test is significantly important here because it will actually give us the full picture of who has already had the virus and how many left of the population are still at risk. The second thing is strict quarantine measures are needed, and this is what we're starting to see globally. But for instance, in the US, each state has their own recommendations and guidance for social distancing and quarantine, and some states are strict on their lockdown, and other states are not as strict and not providing very many recommendations, meaning that most of the population is still going to work and spreading the virus through the community. The third thing is social responsibility. We all have a responsibility to protect each other by social distancing and following the restrictions provided by our local guidance and public health officials. And we also have a responsibility, if we go out and about, to practice good hygiene by hand washing, wearing a face mask to protect yourself and others, and not touching as many things or as many surfaces as possible while you are out or coming in contact with others. The fourth thing is personal responsibility. We have a personal responsibility to take care of ourselves, take care of our immune systems. You all, as biohackers, have a greater ability to do so with your full toolkit of biohacks for immunity. But the general public should be taking care of themselves and making sure that their health is coming first so that they're not as high a risk for COVID-19. The other thing that we can personally do is stay informed with high quality information and not listen to misinformation or fear mongers that just cause panic and anxiety within the community. Now let's focus on the bright side, which directly applies to you as biohackers. The global events that we are currently experiencing around COVID-19 have really disrupted our normal routines and have disrupted normal constructs, which actually provides a very unique biohacking opportunity for us. We are experiencing increased neuroplasticity by being pushed out of our normal routines and ways of thinking, and a highly suggestible cognitive state, or otherwise known as direct access to the subconscious mind. With increased neuroplasticity, you have the ability to grow and shape your brain. With this, you can more easily create new habits or new neural pathways and learn new things. The field of clinical psychology has shown us that traumatic experiences can trigger a highly suggestible cognitive state, or trance state, which is a shortcut to the subconscious mind and its programming. In this state, you can reprogram your thoughts, beliefs, and the processes that are associated with them. Now, you can think of your body's main operating system as your brain and your mind. Your brain is your hardware, and your mind is your software. And with these biohacking opportunities presented by COVID-19, you can now install new hardware and download new software programs for your mind a lot more easily to create any and lasting behavior changes that you desire. If you want to learn how to leverage the COVID-19 experience to upgrade your body's main operating system, as I mentioned, then the Untapped Mind course is open for enrollment. This course is a compilation of 16 lessons in applied neuropsychophysiology, along with a set of evidence-based tools and a step-by-step method and roadmap to follow. The course should take about 2 weeks to complete, but you will have access and be able to utilize the tools on an ongoing basis based on your goals. I've also opened up a scholarship program for anyone who's experiencing financial hardship due to COVID-19. If you are interested to learn more about the scholarship program, please email me. If you want to reach me by email, the best place is biocuriouskayla@gmail.com. You can also direct message me on Instagram at biocurious_Kayla. And my website is www.biocuriouskayla.com. And you can find the Untapped Mind course through Thinkific if you search Untapped Mind. And the link is provided here on this slide.